Hey, Unpacking It community. I'm Bryce. Hope you're doing well. And you've heard me talk about MediShare on the Unpacking It podcast, and you've seen MediShare all over our social media and website and our Unpack This devotional. And they've been such an amazing partner for our ministry. And we're so thankful for their support and being able to link up with them and be able to do ministry together. And so along the way, many of you have had questions, and some of you I've maybe had personal conversations with about MediShare, but I wanted to take an opportunity today to do a video, answer some questions that will hopefully give you some more insight into what is MediShare, could it be the right fit for your family, and hopefully I can shed a little light. But I do encourage you to check out medishare.com/unpackingit, and there you'll find additional information. But today, I'm going to answer some questions and share my experience and my family's experience as MediShare members, because the first question is, how long have we been members? Well, we've been members since 2016, my wife and I, and we got married in 2013, and we had, separate coverage, and both of us at times had traditional health insurance. Well, at some point we decided, all right, we've got to make a change, and we need to be, on the same plan. And so my wife, she did all the research, but when we came across MediShare, it just fit. It worked for where we were at in life then. And the amazing thing is now, with two young daughters and all the life that has happened since then and the life experiences, it continues to be a great fit for our family. And so even over the years, we were able to get the health discount for actually getting into better health. So that was cool, and to save us a little extra money there. And so that's kind of how it all began. Well, then the question is, why is MediShare still a great option for you and your family? And so some of the things that I go back to, it's affordable, right? We're all looking, with the way that the economy is, we all want to save money. And for us, with Unpacking It as a ministry, that's important for us, especially. But for all of us, we all want to find affordable ways to pay for things in life. And so the thing about MediShare is it's not health insurance. It is a health care sharing ministry. And thankfully, though, it helps my family pay for health care costs. And so that's what we want. And so regardless of maybe some of the differing language, which I'm going to explain a little bit more, ultimately it allows my family to be able to afford coverage, and then to be able to trust and know that we are going to be taken care of and share in each other's burdens as the MediShare community. And so the way that they have this structured, it just works out so well. And so I love being a part of that Christian community. I love that the MediShare is a part of a 501c3 nonprofit, just like Unpacking It is a 501c3 nonprofit. And so I love that aspect of it. And then over the years, I've also loved how when my wife has any questions or concerns with something going on with, whether it's bills or health concerns that we're trying to figure out and navigate, she can call up MediShare. She gets the answer, she gets help, and they end the conversation with prayer. And it encourages my wife. And so, the day-to-day, taking care of all that, and then being able to know that you're talking with somebody that actually cares, that wants to help, that's on the same team with you, that's pretty cool. And that's a very unique situation. And so then the other question, does it work? And so how has, our experience worked out over the years? And so specifically, the maternity and pregnancies and the births of my two daughters, that of course is concerning, is financially, how do you pay for all that? but thankfully it worked out great with MediShare. And so thankful for the way that MediShare allowed us the affordability to have our daughters. And so I'll talk more about that in a little bit. The other thing is, unfortunately, my wife has had some heart issues that at a certain time led us to the emergency room. And so the way MediShare is set up and with our plan, $200 for an emergency room visit. Now, it's a lot of money and it's a one-off situation, but beyond the $200, that's where MediShare takes over. And so that's been a huge blessing for us because it has happened, unfortunately, a couple times for my wife. But the $200 emergency room visit at least is doable for us. And so very thankful for that. The other thing, the 24/7 telehealth has benefited our family. With my daughter, Maddie, something happened on the weekend. I think it was like an allergic reaction. We were able to jump on the computer, and my wife and Maddie were able to do the telehealth, talk to a doctor, get an answer, and Maddie ended up getting the right care that she needed, and she was okay. But having that availability on the weekend, we didn't have to go anywhere. That was huge because Maddie was uncomfortable. So that was awesome. The other big thing for our family is we moved to a different part of the city, and we live in the Charlotte area, but there were still preferred providers where we went and where we live now. And so that's a big part of the, using MediShare and being a part of the community is, okay, well, can we go places that are a part of the network, the preferred providers network? And so that's been a great fit for us as well, or great option for us, and very thankful for that. All right, so that's been sort of my story and my family's story. Many wonder, though, what are the main differences compared to traditional health insurance between MediShare and traditional health insurance? Well, instead of meeting a deductible and paying monthly premiums to a corporate institution, MediShare members meet an annual household portion and pay a monthly share. And so, we can plan accordingly and know that we can afford that. And so MediShare members do not have deductibles. Instead, it's this annual household portion, and members choose that AHP range between $1,000 up to $10,500. And so, we fall in there as a family somewhere in there. And so we, choose that, and every family can evaluate what makes sense for you. But we really, like that setup. And then along with that, the AHP is the annual amount a householder is responsible for before medical bills will be approved for sharing. The AHP only applies to eligible medical bills. And then after the AHP has been met, all eligible medical bills will be submitted for sharing for the entire household. So it's all a part of the one household amount, which is really nice. So it's not about each individual. It's not about, each individual injury or situation. That's the annual household portion. And then along with that, the difference is members do not have a monthly premium. Instead, members contribute a monthly share based on age and how many people you have in the household. So members deposit their monthly share into their sharing account. It goes directly into a fellow member's sharing account to pay their medical bills. So that's how it works. We all share in share each other's burdens and share in the medical bills. And so, MediShare has it all structured, and they handle all of that, and it works really well. And that it's not, again, going to the big health insurance corporate, typical thing. What a unique, affordable, wonderful way to be able to pay for healthcare. And so, a further question is, all right, how does it actually work? So I'll take you through the steps. a medical event happens, you select a network provider, you show your Medicare or your MediShare ID card. The provider sends the bill to MediShare. Provider notifies MediShare. MediShare then negotiates and discounts the bill amount. MediShare publishes the eligible medical bill for sharing. MediShare identifies members whose share amount will pay your medical bills, and then MediShare pays your provider with other members sharing funds that are deposited in your sharing account. So those are the steps. It's a unique way, but it's an awesome way. And so that's how it's set up. And so, lastly, why do I recommend and trust MediShare? Well, I appreciate how long they've been around, since 1993. And also, I can confidently say, MediShare has been great for us because we've been a member since 2016. And we've had medical events, we've had births, we've been to the doctor, all sorts of different doctors, especially with our two daughters. And thankfully, we've been in great shape. The other thing I love, it's a community of members and almost 500,000 people. So it's a large yet, it's a small community yet a large community, which is what I like. I was kind of college I went to. It was a big school. App State's big, but it was small. So you like to wrap your mind around it. So I love that aspect of it. And yet I know that, man, there are a lot of people that are MediShare members, other MediShare members that I know. We can always, you're a MediShare? Oh, man, yeah, me too. It's been great. Yeah, you too? All right, yeah, it's awesome. So that's nice as well. And then their vision, the MediShare vision, transforming society through the biblical model of sharing. It's excellent. And then the mission, connecting people to a Christ-centered community wellness experience based on faith, prayer, and personal responsibility. So the heartbeat behind MediShare, that's why we at Unpacking It are aligning ourselves with MediShare. We love Jesus, want people to experience the Christ-centered life. And so we look at it from a sports fan perspective, but then to be able to, hey, well, we know healthcare is so important. Well, let's team up with MediShare. And so I hope that you will consider MediShare for you and your family, and encourage you to check out MediShare.com/unpackingit. Figure out if it's the right fit for your family. Get a quote. Figure out how much you can save. Usually members save around 50% on their healthcare costs. So it's MediShare.com/unpackingit. And we're so thankful for MediShare, and thank you for listening today. And any further questions, you can reach out to me, Bryce at unpackingit.com. But do encourage you to check out the website, MediShare.com/unpackingit. Well, thanks for listening, and thank you, MediShare. Wonderful partnership. Hopefully you join us. Become a member today. We'll talk to you soon. Thanks so much.